Patrick Mahomes was already recovering from a high ankle sprain when, in Thursday night's game against the Denver Broncos, he appeared to dislocate his patella and, after going to get Xrays, was immediately ruled out for the rest of the game. Welcome back, everybody, to your #1 source for learning about everything related to sports injuries and sports medicine news. In this video, we're going to be breaking down Patrick Mahomes' knee injury and patellar dislocation. Make sure and go subscribe if you like this type of content and want to stay up to date with future videos. Let's get started. Mahomes goes into the pile here, and it was really impossible to see exactly what happened, but whenever he was on his back, we saw the trainers basically extending his knee and physically popping his kneecap back into place. Then right after getting X-rays, he was already ruled out for the rest of the game, and the rest of his season could potentially be in jeopardy as well. There's certainly no doubt about it from looking at this clip that he at least has a patellar dislocation, or a dislocation of his kneecap. I don't have as high a suspicion for things like an ACL or a PCL tear, but I'm sure he's going to get an MRI to look for those things because there could also be something like a meniscus going on, but we can for sure see the patellar dislocation, so that's what we're going to focus on. We all know about the ACL, the PCL, the MCL, and the LCL, the four main ligaments providing stability to the knee, but there's another key one that's particularly important when it comes to maintaining the position of the patella. Specifically, it's called the MPFL, or the medial patellofemoral ligament. So medial because it's on the inside of the knee, and then patellofemoral because it runs from the medial portion of the patella to the femur. This is the primary stabilizer of keeping the kneecap from moving lateral or to the outside of the knee. Your kneecap slides back and forth in a groove of the femur called the trochlea whenever you extend and flex your knee. When your quadricep muscles are contracting, they have a tendency to want to pull the kneecap out to the side or pull it lateral. You have these structures, including the MPFL and then also things like the medial retinaculum, that sit here on the inside portion of the knee, trying to keep the kneecap back in place and pull it to the inside. Patellar dislocations can happen from trauma when someone falls or is in a motor vehicle accident, but can also happen to athletes. First off, any sort of landing where you have a twisting at the knee and have that foot a little bit externally rotated. But what it looked like was more likely with Mahomes here, just any direct load where it pushes that kneecap and forces it outward. As we saw the medical team here, the way you relocate this is by extending or straightening the knee as you're pushing it back in place. The first step in evaluating a patellar dislocation, especially if it's the first time it happens in someone, is to get X-rays. If you think of your patella kind of sitting and tracking in that groove of the femur, depending on the amount of force with which it's dislocated and slams against the femur, you can get, at a minimum, significant contusions in the bone, but you can also get a fracture. If there's a big enough fracture, that's one of the main indications for needing surgery. Oftentimes, you also tear this MPFL ligament. The fact that they ruled him out right after the X-ray makes me concerned that they saw a fracture, but even if the X-ray would have been normal, I doubt that he would have gone back out to play. A joint effusion is whenever the joint gets filled up with fluid or blood. There's three big things we think about when covering sports events when we see an athlete get an injury and then have a big knee effusion. Those are ACL or PCL tears, patellar dislocations, and fractures. So most likely Mahomes' knee is going to be so big and swollen and stiff that even if there wasn't a fracture, he probably wouldn't be able to go back out and play. So of course, the big thing everybody wants to know is, what does this mean for the rest of his season? At the time of recording this video, there's too many unknowns and further steps needed in this workup to determine what they're going to have to do to treat this. I'm sure he's going to have an MRI to determine the full extent of ligament damage and look for the possibility of something like a meniscus tear or tear to these other ligaments. The challenge of managing knee dislocations is once you've had one, you're at a really high risk of having another dislocation. If it were just you or me who this happened to and there's no fracture, we're probably not going to need surgery right away. We're going to rehab it, we're going to wear a knee brace for a certain period of time, but ultimately we're probably not going to need surgery. But in the case of a high-level athlete like Mahomes, then you kind of have to have a different conversation. He's got his whole career ahead of him, and he certainly doesn't want to be at high risk of having repeat knee dislocations. Even if there's no fracture or other ligament damage, it really wouldn't surprise me at all if he does undergo some sort of surgery to provide that stability back to the knee. Sometimes they'll try to reconstruct that MPFL ligament or tack it back down, trying to maintain those structures, pulling that kneecap back in place. With initial conservative management, he's going to be wearing a knee brace that provides support around that patella. The last thing you want during this time period is for it to dislocate again, and so he's going to have a brace on, keeping that kneecap in perfect alignment. So we'll see if he does end up needing to have surgery because of instability or significant fracture in that knee. His season could certainly be in jeopardy. Stay tuned to the channel for more updates if we get them, but I hope this was a little bit educational, teaching you guys about patellar dislocations and some of the other things we have to consider for the initial management and workup. Thanks for watching, and I'll see you guys in the next one.